Hello everyone, it is Nicholas from Aussie MONEYMAN. So in this video, we're going to have a look at private health insurance, what it is, why people use it, why you may use it, a bit about just sort of its general nature and how it works and all that sort of stuff. So with that said, let's jump into it. Real quick, as always, you can check the description below for things like our website, Facebook groups, news features, and other things that you may find interesting. So feel free to look through the description while you watch the video. Alright guys, so pretty much recently I started looking into private health insurance and researching it a ton basically over the last week or so because I need to consider getting private health insurance basically for tax purposes at this point. Now if that doesn't make sense, it will make sense quite soon. So let's start off with the simple part, which is basically what is private health insurance. Well look, in Australia we have of course Medicare. So Medicare is basically the tax funded government medical or healthcare system. So basically all citizens of Australia, so anyone residing here in Australia who is a citizen of Australia, when they pay their tax, they pay a thing called a Medicare levy, which is basically an extra 2% that goes towards medical care. But in return for that, we get free medical care when it comes to a lot of different things. So general GP checkups, if you go to a bulk billing GP, that basically just means the GP doesn't charge any more than the amount that the government's already paying for you. That's why some GPs charge a bit and you get some back from the government, and others basically they call it bulk billing. They pay for the entire amount, they don't charge any more than what the government is paying them essentially, right? Because they get this rebate. Now the government scheme Medicare pays for a lot of different things. So it covers, when I broke my wrist and I had to go into hospital, they covered that. A lot of the sorts of injuries, if you get like an ear infection, you go to hospital, they take care of it. They cover most things, most surgery, most medically necessary things, and that's brilliant. But there's a lot of things that they also don't cover. So real quick, basically Medicare doesn't cover things like optical, hearing, so that's things like glasses, hearing aids. They don't cover a lot of specialist appointments, so you need to go see a physio. They don't cover ambulances, so ambulance trips. There's a few things that they don't cover, although, again, they still cover a lot of things. Like, for example, when I broke my wrist, the only thing I ended up having to pay for, I think, was the cast, and they pay for everything else when I got metal put in, all that sort of stuff. So it was really, really quite great. But now basically the reason people run into an issue is basically twofold. Number one, when you're using the public system, I guess there's probably three main reasons I've jotted down. Now, the first one is when you're using the public system, you don't have choices of like hospitals. There can be really long wait times, all that sort of stuff for the stuff that Medicare does cover. So that's reason number one that people might want private health insurance. Reason number two is to get insurance for those things that Medicare doesn't cover, things like hearing aids, things like glasses, things like physio, or even cosmetic surgeries. So cosmetic surgeries obviously aren't covered by Medicare, and that's a second sort of big reason. And I guess in theory it could be an unlimited amount of reasons, but these are the main ones. And the third reason, I suppose, is basically the tax reason. So this is the real big one, and the reason that I've personally started looking into private health insurance. And the reason that, I think a big reason that I'm making this video now, so basically what happens is you pay that 2% Medicare levy base almost no matter what. But there's a thing called the Medicare levy surcharge, different to the Medicare levy, that 2% I described before. Basically, if you're a single, it's over $90,000, and I'll have the rest of the information on screen. And basically, it's an extra 1%, and then between like 90,000 and I think like 114,000, something like that, I'll have it on the screen, it's 1.5%, and then it can go all the way up to, I believe, 2%, although it keeps changing. I'll have that information on the screen. Basically what happens is you pay more tax because you're making more money. Now the reason the government say they do this is basically to encourage high income earners to get private health insurance to take the burden off the public system, so Medicare. Now, the issue with that is, I'm not going to get into the politics of all this, but basically the system's a little bit flawed, it's a little bit deceptive, and in reality, that's not the reason they do it, and it doesn't, it's factually incorrect, and there's a lot of reasons to not believe that, but nonetheless, that is what they say. So what the situation you're left with is a lot of high-income earners will go out and get private health insurance. Now, there's something quite interesting that occurs here. What happens is a lot of private health insurance company providers, and I'll get into all the details of all sorts of different things like how to compare and how to pick and all that in a second, but basically the interesting thing that ends up happening is you get these things that what people call junk health insurance policies, and basically they're health insurance policies that don't really cover you for bloody anything. Like they might just let you choose a doctor, and this is what I mean with that reason number one why people might get private health insurance, because they want to be able to like pick a doctor or have less long waiting times or get a private room in the hospital or pick which hospital they go to, all things that you can't do through the public system, right? Because it's tax funded. It's sort of like you get what you get. It's medical care, be happy with it, which in all fairness is probably reasonable. But what ends up happening is you'll get this junk health insurance policy basically as a tax dodge, and it may do nothing except for like let you pick a doctor or let you go to into a private hospital, but it won't actually pay for anything that you actually need. So like if I broke my wrist again, for example, the private health insurance wouldn't actually pay for anything. But because you have that hospital cover, because you have that private health insurance, basically what will end up happening is then you save the tax. You don't have to pay the levy surcharge. So the Medicare levy surcharge, you don't have to pay that if you have private health insurance hospital cover. So that's real one quick thing. Let's basically jump into talking about the health insurance itself and how it works. So private health insurance there's basically sort of like 2 or 3 parts of it. The first part is hospital cover, so that's covering you for if you get admitted into a hospital. It basically will cover you for different things depending on the level of cover. Then you've basically got extras cover, so that's basically covering things like physio, dental, stuff like that. And of course, there's different levels of that, so it can cover different amounts and different things. And then you've basically got ambulance cover. Now, sometimes they're combined, sometimes they're separate, but you've really got these sort of 3 streams of private health insurance. In order to avoid the Medicare levy surcharge, you just need the hospital cover. The rest doesn't matter. You just need hospital cover. And this is what I mean when I mention these junk policies come along and people end up using those, because of course you save money doing that. So for example, let's say you're making $200,000 a year, and let's say the Medicare levy surcharge is 1.5%. That's about $3,000 that you're paying in extra tax. So you can get policies, for example, they range for all sorts of different prices, from $5 a week for extras cover all the way up to like $120. And then for hospital cover, it goes from like $900 a year all the way up to like, many thousands and thousands of dollars, up to like, I think I've seen one for like, I think it was like $8,000 for like the top hospital cover, for example. So it can vary a lot, but if you just get like all you need is some sort of hospital cover to cover you, you get the cheapest hospital cover that covers basically nothing for $1,000, and you've saved yourself $2,000. And that's why these junk health insurance policies exist, and it's really just quite a mess. Now, one thing I want to mention here is basically, so let's say you've decided you want to get private health insurance and you want for extras cover, and for whatever reason, or you want to get hospital cover or anything like that, there's actually a government website that compares every health insurance option available in Australia, and I recommend you check that out. So I'm going to link that down below, because there's a lot of private companies that do it. The issue with that is, firstly, they're getting paid by the company, so they have incentive to basically deceive and do sort of dodgy things, and 2, they often don't show all the companies, because they're only showing the companies that are paying them to be there. The government doesn't do that. So if you really want to go with the government sites, I'll link that down below. The issue, another big issue I noticed, by the way, and I'm sure a lot of you guys will have realized this, or maybe not, so hopefully this helps you when I tell you this, is when you search up like health insurance comparisons and stuff, you get all the private aggregators and comparison sites and actual health insurance companies first, and then you actually have to keep scrolling for a while to find the government comparison site. And of course, that's the one that you want for the reasons that I just mentioned, and really many others. Like, the government actually shows all of them. It doesn't have incentive to prop other ones up, and they're not being paid for it, right? So really, it's a much more unbiased way of getting a holistic view of what's available on the market to get the best thing for you. Now, the other thing I just want to mention, not drastically important to this video, but just giving you guys an overall look. If you don't know, with the health insurance, as of somewhat recently, I think it was 2019, they made these sort of new rules to make it a bit more simple when comparing. So basically, every company has to have like a PDS that you can download for each policy. It tells you what you're covered for, how much for, the waiting time, because there's like waiting time. So you obviously can't sign up to the policy right when you get an injury and get them to cover it for you. So all this different sort of stuff. And there's like tiers: bronze, silver, gold, all this sort of stuff that they've implemented. But I'll put the links down below for that sort of stuff. But the main reason I made this video is basically to answer the main question, sort of as I had come up at the beginning of the video, and sort of the little side bit there, is basically the answer question of like, is health insurance worth it? And if you're making over a certain amount of money, it very may well be, especially if it's like a real large amount, because it starts becoming a percentage. If you make $500,000 a year, 1.5% of that, it's like, yeah, it's bloody worth it to get a cheap health insurance policy. And just for the record, guys, if you're not sure in this, feel free to ask any questions for things like this, but like, you're still covered by Medicare. It's just that they want you to have private health insurance, all right? So you can pay, the cheapest health insurance policies, as I mentioned, I can find for around $900. Pay them $900 a year, save all the money on tax, and still use the public system. That, like, in theory, I'm saying, like, that can be done. Now, again, of course, if you have a lot of dental problems and you want to go cover yourself for what's called extras cover, as I mentioned before, you can go ahead and do that. But really, what I want to talk about here was the tax aspect of it. Because again, after you start making over a certain amount of money, they're going to start taking more money from you. So you may be better off to get private health insurance. And whether or not that you get basically a junk policy, which seems to be something that a lot of people do. It covers nothing, but it's just a tax dodge, which is insane to me. I thought that was crazy when I heard about it, because The government definitely knows that that's happening, but anyway, again, I'm trying not to get into politics about that. You can basically use that information to decide if private health insurance is worth it for you. You know, I mean, I know from my personal situation, I've never had it once in my life. My parents didn't have it, all that sort of stuff. You guys know I didn't come from a particularly wealthy background. I've always just used the public system and not really known anything else. I've always just gone to bulk billing GPs, specialists I've had to pay for, like most other people. Sometimes a specialist will bulk bill, although it's not that common. And yeah, pretty much that's been it. But the world of health insurance exists, and this is basically it. So I hope this has given you guys some information as to how private health insurance works, a bit about Medicare as well, because you sort of need to know about that to know about private health insurance, and then to sort of help you guys make a bit of a decision on if private health insurance is worth it for you and maybe a good decision. Of course, again, there's all those other factors I mentioned before. There's three main reasons beyond tax. So there's other two reasons, which is maybe you just want to be able to pick your doctor, maybe you want more comfort, maybe you want to pick your doctor or pick your hospital, or get a private room rather than a shared room. You know, maybe you want to be covered for ambulances, maybe you want to be covered for dental, maybe you want to be covered for physio, all those sorts of things that aren't covered by Medicare. So, you know, and there could be a bunch of other reasons why you want private health insurance. Maybe you have a medical condition, you're really prone to medical conditions and stuff like that. And one quick note on that, actually, this may help out a few people, is that from my reading and from my calling, I called quite a few of the health insurance companies and asked different questions and stuff. They can't actually ask you about your medical health or condition or anything like that. They can't do that. They basically just ask your age, which state you live in Australia, state or territory, and that's basically all the information they're actually able to use to charge you. So they basically won't charge you more if you, for example, have like a medical condition or are more prone to medical conditions, that sort of stuff. So anyway, guys, please hit like on this video if it has been useful. This video is really going back to the roots of Aussie Moneyman and how it started, which is basically I'm researching something for myself, and I just put together a video to help you guys out, share that information with you, and hopefully make someone's research into all of this a little less time consuming and a little bit more simple for you. So thank you for watching. As always, our free ebook is linked down below. So that ebook is something I wrote up real quickly, explaining how I make money from market research. So that's one of the ways I make money. Completely free to download, has all the links to the exact sites I use. And of course, eToro is offering their 100 USD bonus on your first investment of 1,000 USD or more, or first deposit of 1,000 USD or more. The first actual trade, so that what you buy into, can be any size. So that link will be linked in all my relevant eToro videos. So any video in the eToro playlist on this channel, if you check out the description, will have the exact steps of what you need to do to get that 100 USD and all the explanation. And I'll have the link to the eToro playlist down below. So that will be there. Again, guys, thanks so much for watching this video, and I hope it has been useful.